Pathology Coding Basics. Introduction. Welcome to our Pathology Coding Basics video. In this session, we'll cover the fundamentals of coding for pathology services, including biopsy, cytology, and histopathology. Fundamentals of pathology coding. Pathology coding involves assigning specific codes to laboratory tests and procedures performed on body tissues and fluids. These codes are crucial for accurate billing and biopsy coding. A biopsy involves taking a small sample of tissue for examination. The coding for biopsies depends on the method and site of the biopsy. Let's look at a flowchart illustrating the coding process for a skin biopsy. Flowchart details. 1. Identify the site of the biopsy, example skin, liver, breast. 2. Determine the method, example needle, punch, excisional. 3. Assign the appropriate CPT code, example 11102 for tangential biopsy of the skin. Cytology coding. Cytology involves the study of cells from fluids or tissues. Common cytology tests include pap smears and fine needle aspirations, FNA. Here's a flowchart for coding a fine needle aspiration cytology. Flowchart details. 1. Identify the type of cytology test, example FNA, pap smear. 2. Determine the site of the sample, example thyroid, breast. 3. Assign the appropriate CPT code, example 10,021 for FNA without imaging guidance. Histopathology coding. Histopathology involves examining tissues under a microscope to diagnose diseases. It includes both routine and special staining techniques. Let's examine the coding process for a routine histopathology. Flowchart details. 1. Identify the type of tissue examined, example liver, kidney. 2. Determine the staining technique used, example hand A, special stains. 3. Assign the appropriate CPT code, example 88305, for a level 4 surgical pathology, gross and microscopic examination. Coding guidelines. When coding for pathology services, it's essential to follow specific guidelines to ensure accuracy. Guidelines details. 1. Use specific codes. Always use the most specific codes available. For instance, differentiate between superficial and deep biopsies. 2. Follow payer policies. Ensure compliance with payer-specific policies and guidelines, which may vary between insurers. 3. Document thoroughly. Thorough documentation is crucial for accurate coding and billing. Ensure that all procedures and findings are clearly documented. Summary. In summary, accurate pathology coding involves understanding the procedures, following specific guidelines, and using the correct codes. Biopsy, cytology, and histopathology each have unique coding requirements that must be carefully followed. Thank you for watching this Pathology Coding Basics video. For more detailed information and advanced coding techniques, be sure to check out our other resources and videos. Again, there are the quick flowcharts for coding in these areas. Biopsy coding flowchart. 1. Identify the site of the biopsy, example skin, liver, breast. 2. Determine the method, needle, punch, excisional. 3. Assign the appropriate CPT code, 11102, for tangential biopsy of the skin. Cytology coding flowchart. 1. Identify the type of cytology test, FNA, pap smear. 2. Determine the site of the sample, thyroid, breast. 3. Assign the appropriate CPT code, 10,021 for FNA without imaging guidance. Histopathology coding flowchart. 1. Identify the type of tissue examined, liver, kidney. 2. Determine the staining technique used, H&E, special stains. 3. Assign the appropriate CPT code, 88305, for a level I4 surgical pathology, gross and microscopic examination. I hope this introduction is helpful, and I will have many more videos to come.